we're talking about issues of malpractice. And we're talking about issues of medical jurisprudence and medical ethics. And so when we think about that, before we start, I have several silks that you see here. And I'm going to start by taking, is it okay if we continue even though the bell is ringing? I will start with these two silks, the two red silks, and I will tie them together into a knot. So we have the two silks tied together. Now, may I ask, may I have you hold your hands over for me? Because I'm going to put the two silks into your hands. I'll have you close your hands together. Yes. So now I cannot get to these silks. Am I right? These silks are in your hand and covered. I cannot get there to put anything there. Is that correct? Okay, very good. Now, I have three other silks here. And we talk about inappropriate activities when we talk about issues in malpractice. And so for the first silk, we think about something happening, some kind of untoward result about which we're not happy, or the patient is not happy. That goes into the box here. And then perhaps something else happens. We talk about abandonment, failure to have coverage for us, and so the patient brings a complaint. And then we talked about ethical breaches, one of which is having inappropriate contact with our patients. Remember, malpractice insurance does not cover ethical breaches. Then, when something happens and there's a malpractice action, we hire an attorney, a defense attorney. We remember that in res ipsa loquitur, the duty of defending passes to us immediately because we are no longer held innocent until proven guilty. When it comes to issues of res ipsa loquitur, we are essentially guilty until we are able to prove ourselves innocent. So we utilize the courtroom, and remember, the trier of law is the judge, the trier of fact is the jury, the two attorneys are the combatants in the courtroom, and hopefully, after all is said and done, we are able to show that there was no commission or omission and error in fact. So we get a clean silk. We are able to show that if in fact that what was claimed was an error in judgment was actually not inappropriate at all, and our colleagues would agree with what we did, and we're able to show that in fact there was no malpractice, so we have all three clean silks. And of course, we now are able to leave the courtroom and feel really good that we are practicing appropriately and that our integrity has not been impugned. The key then is that we want to thank our attorney, and our attorney, in a moment, I will count from 1 to 3 and not before. And when I reach 3, I'll have you open your hands up, and you will notice on the count of 3, 1, 2, 3, you may let go. We get our attorney back, and we're able to thank him or her for having successfully defended us. Thank you all very, very much. I will see you all tomorrow. Thank you, and we'll pick up where we left off today. Thank you.